Hi, Dr. Albitar.
Hi, Darryl.
Thanks for taking time this afternoon to talk with us. Um, this afternoon for me, morning for you. I'm in New York, you're in California. Good, we don't have to fly in to meet each other and do this. We're going to talk today about genomic testing for gay men as well as for transgender women. As you know, like Malecare is one of the pioneers of understanding of the psychosocial support for transgender women with prostate cancer. In general, we've helped dozens of transgender women navigate access to care for all different types of cancers. Genomic tests apply to lots of different cancers, and I'd love to hear your insights on that. But first, tell us what kind of doctor you are and where you work.
I am a pathologist in training, and specifically, I am molecular pathologist. I am the CEO and CMO of Genomic Testing Cooperative. Genomic Testing Cooperative is a diagnostic company that is focused on cancer, and in particular on the molecular profiling of the cancer. So we figure out what the driver abnormalities in the cancer, as well as what changes in the host, which is the body of the patients, and put the information together so aid the clinical physicians who is treating that patient to make the right decision for the right patients, and that's so-called precision medicine or personalized medicine.
Sure. And what is a genomic test from a patient point of view? A blood draw, a lengthy biopsy? What is involved here?
Yeah. So it can be a blood draw. It depends on the disease, as well as it depends on the stage of the disease in the patient or the cancer in the patients. But in particular, it is very important to look at the cancer itself. So we obtain the biopsy sample or the excisional material from the tumors and do complete profiling. At the same time, we do profiling sometimes from cell-free DNA in the blood, as well as sometimes we look at the lymphocyte and the immune system in the patients and profile all these informations to provide adequate information on the cancer and the patient or the host.
So not a particularly invasive, certainly with a blood draw, we wouldn't call it invasive at all, but biopsies are usually done whether you're having genomic testing or not. So your flesh is already out of your body. You might as well have more investigation done on it. That fair to say?
Absolutely. Absolutely correct.
So for gay men and bisexual men and such, there's a long history of trying to figure out and why we would even want to figure out, is there a gay gene, and all the mostly toxic attributes to understanding that stigmatization, will it end up on my employment record or military record or whatever, and in these days in the United States, there's great fear around LGBT discrimination, more so perhaps than 6 or 7 years ago. So what do genomic tests tell gay men that's different that they might tell straight men, heterosexual men?
Right. Just to start, cancer has nothing to do with whether you are genetically gay born or straight born. Cancer happens because of genes not related to the sexual orientation at all. However, the lifestyles of gay and lesbians and transgenders, the exposure through life, the socioeconomic factors, all these make the cancer might be different in this group of patients as compared to white white straight patients, but has nothing to do with whatever genetics drivers for the sexual orientations. So, unfortunately, most of the studies on cancer and cancer treatment, cancer therapies, and early detections are done on white straight populations. There's very little studies done on patients who are LGBTQ populations, and it is quite possible that the cancer it might be biologically different, as well as the treatment and the immune system is different. For example, we know that there is higher incidence of anal and rectal cancers in gay men, and we know, for example, that patients, especially transgenders, they are taking hormonal therapies, they are taking different things. We know very little today about what the effects of these changes in these populations, and whether they need treatment that it is different from the straight white populations. For example, other things, we know there's higher incidence of HIV, HPV infections. All these are important in understanding the cancer, and it is very important at this time to accumulate data and to manage these patients based on their specific genomic abnormalities, and rather than lumping them with the rest of the populations, because they might require different therapeutic approaches, and these information are relevant. Of course, the concern about stigma and HIPAA regulations, practically, in my opinion, there's enough safeguards in today's practice of medicine to prevent potential bias and discriminations when it comes to the treatment. So these are really more cancer related, and they have nothing to do with hopefully other things, and people will understand the importance of this, and data should be accumulated and used to design therapy that is specific for this population.
Yeah. And, a concern of feeling like you brought this, a patient brought this disease on themselves as a consequence of behavior. It's worth saying, no, you didn't. You lived your life, and, that's what life's about, living, and disease comes into it occasionally, and more often than not as we get older. Oral cancer is very big in the community, and it's I've heard one doctor specifically and really damn that person, but for saying his patients brought that on themselves, that's just crazy and wrong, shame on that person. But the idea of transgender men and women having an added layer of concern around privacy, and identification as a consequence of the test. You've gone through effort and acknowledgement and self-understanding that a cisgendered man is actually a woman, and now you have a test that may actually say, no, you're not, or something. How does that play into it?
Absolutely has nothing to do with again, the genetic sexual orientation. This is only looks at the oncogenes, tumor suppressor genes about the immune system in that particular patients. So absolutely, there's no fear and no concerns about lifestyles or perhaps genetics factors that play in sexual orientations. This is only to look at what drives the cancer and how we can really fight that cancer, irrespective of anything else, no different than any other cancer studies that we perform on straight or other population. Yeah. So there's no risk at all.
Is the treatment or the efforts that fully transitioned men and women have gone through, does that confound the opportunity for genomic testing to be useful?
No, the answer, just in summary, no. But again, we need to accumulate data so we understand how we can adjust perhaps the therapy. It's quite possible the immune system is not fully functional, or perhaps might be more functional, and maybe we need to figure out how to turn it on so to fight the cancer more aggressively than a different person who has a different driver for the cancer. So we know, for example, what drive lung cancers are different, whether it is exposures as well as genetics, inherited things, we can really adjust the therapy according to the driver of that cancer. It's the same concepts when it comes to a specific cancer, whether it is the oral or anal or other types of cancer or prostate cancers in gay populations or transgenders. We need to understand what drives that cancer and specifically design therapy to fight these abnormalities in these populations, rather than lumping them with the rest of the populations, because the driver of these cancers might be different. And this is where the efforts, I think it is time now we put more efforts into these types of studies, and also make sure that these populations are included in clinical trials that are currently being being used to validating new therapeutic approaches, so we have a better presentation of various segments of the populations. Clinical trials are very important in understanding how the new drugs that being approved by the FDA, how they can work and what's the outcome. And unfortunately, most of the current clinical trial and the old clinical trial were performed without considering these populations, and they are not presented in these clinical trials. And that's one of the defects that it is time to close that gap and be more inclusive in our clinical trials.
So are there any questions that you think LGBT people should ask their doctors around genomic testing that might be unique for our community?
I personally believe, in my medical opinion, that every patient, if you are LGBTQ or otherwise, you should really ask to have your cancer completely molecularly profiled, have the information, sit down with your treating physicians discuss the findings, and determine what options you have and choose which option for therapy would fit you best, and go from there.
Wonderful. And we didn't talk about the intersection between people of color and LGBTQ. We have other videos on that, and I'll encourage our audience to seek them out on our YouTube Malecare channel, youtube.com/Malecare. Hit subscribe button, and you'll get in touch with those. But for now, thank you, Dr. Albitar, for these wonderful insights. I encourage everybody listening to speak to their doctors about genomic testing. It's absolutely a no-brainer to ask about it, and may in fact be life-saving if you actually follow through on it. So thank you very much.
Pleasure. Thank you.